School's taking more time. And again, some of that's because my clinical's an hour away. Get a rotation at the place where you actually want to work. If you're in a long distance program, advocate for the kind of clinical experience that's going to be relevant to you if possible. Community health rotations, very diverse locations, lots of different things. I definitely, if you're not wanting a hospital job, this would be a rotation to really work hard on trying to get a rotation at the place where you actually want to work. Originally, I thought that's what I was going to be doing. I thought I was going to get a rotation at the home health agency that I want to eventually work at. To be honest, we have not picked a home health agency that we're going to work with when I graduate. Our current nurse and I, because as a team, we both want the agency that will pay the best. Surprise, surprise. And we've not negotiated that yet. So I need to get on that. But I didn't know what agency I was going to be working with. And I gave Elmhurst a little bit of information about the agency that's currently in our home, about working with them. They didn't follow up too close on that. And I do think as this program gets more established, Elmhurst is getting used to, these are spots we do clinicals at and we're familiar with them, and they're going to be maybe a little less open to doing rotations wherever people pick. I hope not. It made it so much easier to work during school. It made it so much easier to see potential jobs in my community. That wound clinic is a private run, I think, for-profit wound clinic, and the one I'm going to, even though it's in the same hospital system, is part of the hospital. So I get why they maybe couldn't get me a rotation in the other one through their normal routes. And I think I'm at the better wound clinic by driving an hour. So in the end, I was okay with the rotation I have, and I really like the rotation I have. But yeah, if you're an Elmhurst student, or if you're thinking about going to Elmhurst, I will just say you might have to work harder than I did at securing specific sites if that's really important to you. And I encourage you to do that. That said, okay, driving an hour to clinical rotations and having to go more times because there's not 12-hour shifts available, and it just being near the end of our schooling, so we have more clinical hours that we do a semester than near the beginning of our schooling, plus that 5-part big project. School is busier now, I think, than it was at the beginning. I think I'm spending more time on schoolwork now than I was at the beginning of this program. And also, at the beginning of this program, it was a lot more learning and memorizing, I think, instead of research and projects. So it was easier to study as I drove, like Raylan to doctor's appointments. I could listen to YouTube videos that were going to help me with my test. And there's still a little bit of that. Community health, there's definitely some YouTube videos that help with the exams on that. But the exams are not as big a part of our grade on community health. It's this humongous project that's the biggest part of our, it's like 40% of our grade is this 5-part project. So school's taking more time. School's taking more time, and I actually completely quit Play Talk Grow for the next few weeks, and we're just busier too. My kids, it's a busy time of year. My kids are busy. Raylan has more care needs than she did, I feel like, at the beginning of this program. So I think I said at the beginning, you can work and do school if you need to, you know, depending on your support system and your circumstances. And if I didn't have 3 teenagers and a medically complex kid, I might be able to work still. I might even be able to work. A full-time job would be very difficult at this point, but maybe I could get in 30 hours a week and still do school if I didn't have a social life outside of this program. But there is light at the end of the tunnel. I mean, it's very time limited. So I don't know. I also just wanted to give an update on that. I think I've always advocated that this long distance program is very flexible and one of the easiest ways to get a degree and still balance other responsibilities. The end of this program's getting pretty busy. And again, some of that's because my clinical's an hour away. So every day I go to clinicals is 2 extra hours at least in the car. That's 22 extra hours just in the next 6 weeks of stuff that I have to do. just driving. But I hope that helps you know a little bit more, one, about community health rotation, community health documentation, or what you might be doing, and then Elmhurst specifically, or probably other long distance programs are working similar to Elmhurst. You know, I just really encourage you, see, before you get into a program, ask them some questions about, will you help me get the clinical sites I want? Will you try? They can't guarantee it, but will you try to help me get the clinical sites I want if you have some specific sites in mind? And then for sure, you have to do your work too, reaching out to the place. Like I said, there's a wound clinic closer to my house. I thought it was connected to HSHS hospital systems. It's not. Had I gone directly to that wound clinic in person and asked about doing clinicals there, I might be at the wound clinic 30 minutes from my house. I didn't do enough homework on that. I'm okay with that because I just kind of figured, well, the wound clinic in my 30 minutes from my house maybe doesn't see as extensive of wounds. They don't have the hyperbaric oxygen chamber like the wound clinic I'm going to has. I kind of thought I would see a more expert level of wound services by going to Springfield. I'm not 100% sure because I haven't seen the one 30 minutes from my house. I know that they don't have hyperbaric oxygen chambers, so that's a negative for them. And it sounds like they might be private for-profit instead of part of the nonprofit hospital. In my opinion, that could be a negative for them too. So I think I'm at the better wound clinic location ultimately. If I thought they were equal, I think I would have tried harder to get switched to the Litchfield, the 30-minute from my house location instead of driving an hour. But yeah, I'm rambling, but summary, community health is a diverse clinical experience. If you're in a long distance program, advocate for the kind of clinical experience that's going to be relevant to you if possible. And yeah, your documentation's totally different probably. You probably have a big old project, but it can be fun. It can be exciting. I think it's hilarious that I've asked if I can apply for a grant for this clinic. I'm curious what they're gonna say when I tell them today, hey, so I'm looking at focusing on these supplements and trying to get you guys samples from reps and trying to see if there's a grant that'll help pay for some. I don't know what they'll say. I might get my hopes dashed. They might be like, what are you doing? No, this has to get approved. I don't know. We'll see. It's gonna be a fun day.